And so far I've not been disappointed.
When did you come to the Atlanta area to practice?
January 1990.
What's the name of your practice, doctor?
Northwest Georgia Oncology Centers.
And where do you practice?
I practice in Marietta, Georgia.
What hospitals do you have privileges?
I have privileges at all Wellstar hospitals except Windy Hill. The main hospital I practice out of, however, is Wellstar Kennestone Hospital.
Are you employed by the Wellstar Health System?
I am not.
Have you ever been employed by the Wellstar Health System?
No.
Now, during the course of your practice, did you have occasion to treat a patient, see and treat a patient named Glenn Harper?
Yes.
Now, when did he first become a patient of the practice to which you belong?
I believe it was in 2000.
Would you pull up page 876, please, Kevin? And if you could focus in on the top part here. Right. Now, is this a note of the first office visit of Mr. Kenneth Glenn Harper to your practice, Northwest Georgia Oncology?
Yes, it is.
And for what reason was he seen? And it's down here, if you would.
He was seen because he had problems with a low platelet count.
What are platelets?
Platelets are little particles that float around in the blood, and their job is to dam up holes in the blood vessels, either that get there through either injury or surgery, and they keep a person from bleeding to death whenever there's a hole in the blood vessel. And these platelets act like little corks, and they go into the hole in the blood vessel and dam it up so all the blood doesn't leak out.
Doctor, was a reason found for Mr. Harper's low platelet count in the year 2000?
No.
Did he return to your office? Page 880, please, Kevin. And these date stamp numbers are in the records of Northwest Georgia Oncology, which will be in all. When was Mr. Harper next seen in your office?
He was seen in December 2003.
What was the problem with him?
He had ongoing problems with a low platelet count.
And was any reason found for his low platelet count in this visit?
No.
And which one of your partners saw Mr. Harper on these occasions?
Dr. Robert Herman.
Is he still your partner?
He just retired at the end of June.
Let's go to page 883. And if you would blow up that whole note, including Dr. Harper's. Was Mr. Harper seen again in your office after the second visit to low platelets?
Yes.
And what was the date?
April 26, 2004.
And platelet count is in the lower right-hand corner?
Yes, 79,000, which is below the normal limit of 140,000.
Would it be correct to say then that between the year 2000 and 2004, Mr. Harper had sporadic drops in his platelet count?
Yes.
And did drops in his platelet count, did that place him at risk for bleeding? Or uncontrolled bleeding?
At those levels, he shouldn't have had any significant bleeding troubles.
Now, did you have occasion to see Mr. Harper when he was admitted to Kennestone Hospital on October 5, 2006?
Yes.
And what was the reason that you were called to see Mr. Harper in consultation?
I was asked to see Mr. Harper because he had a low red blood count, a low white blood count, and low platelet counts.
Go to page 198, please, Kevin. And right down here. And what was his white count on admission?
It was 2,700.
And what was his red cell count on admission?
It was 6.2 was the hemoglobin, and the hematocrit was 18.
And are these numbers significant?
Yes, they are. The hemoglobin and hematocrit are very low and would cause Mr. Harper to have symptoms.
Symptoms of what?
Being weak, potentially dizzy, having shortness of breath whenever he walked, and just having no energy.
Shortness of breath called dyspnea.
Yes.
Let's go to page 199, please, Kevin. Right up here. Now, what about Mr. Harper's platelet count? Was that again low?
Yes, it was. It was 36,000, which was substantially lower than what it had been before.
Now, let's go to page 35, please. And is this your progress note of October 6, 2006?
Yes, it is.
And what was your plan to address these problems, or to try and find out the cause of these problems?
Well, I was going to do certain blood tests to see if his anemia or low red blood count was related to his blood cells breaking apart in his bloodstream. I was going to check to make sure that he wasn't low in iron or B12, which can cause low blood counts. And that was the first things I was going to do.
Take a look at number 3 just a second. No, the INR. Now, Mr. Harper had an INR of 3.4 and a history of mitral valve repair and an artificial mitral valve. What was the significance of the INR of 3.4 in conjunction with the platelet count, which I think was 34?
Having an IR of 3.4 and a low platelet count of 36,000 would put him at high risk for bleeding.
Let's go to page 41. Now I'd like you to take a look at your note of the next day, October 7th. Let's look at bring that a little bit. All right. Had Mr. Harper received some blood transfusions during that period of time, during the first few days he was in the hospital?
Yes.
Can you transfuse the body with white blood cells?
No.
Why not?
Because basically the white blood cells recognize that they're in the wrong person and they can attack the person's body.
So transfusions can only be of platelets and red cells?
That's correct.
But not white cells?
Correct.
And where are the white cells manufactured?
The white cells are made in the bone marrow.
And what was your plan on October 7th?
The plan was to transfuse 2 units of red blood cells. I was going to adjust the Coumadin, and then finally I was going to order a bone marrow test to see why Mr. Harper wasn't making blood cells properly.
Is that a bone marrow biopsy?
Yes.
Is that something you do yourself?
I have an assistant who does those.
Let's take a look at page 49, please, Kevin. And if you bring this note up. Is this your signature here in the bottom of the note?
Yes, it is.
And whose signature is this right there, the physician's assistant?
That's Lynn Thibodeau, who was my physician's assistant at that time.
And what is this note of? What does it represent was done that day?
What she's describing is the bone marrow biopsy procedure that she did on Mr. Harper on that day.
We've highlighted her note that says attempted aspirate times 2 and an arrow then dry. Obtained 2 biopsies without difficulty. What is the significance of a dry aspirate?
So the blood cells within the bone marrow should be in a liquid format, so that when you stick a needle in there, you should be able to withdraw bloody-looking dark material, and that's the liquid part of the bone marrow. And in this case, she was unable to get any liquid bone marrow after 2 tries. And then she goes on to say that she got a bony core, which is a kind of solid sampling of the bone marrow, and she was able to do that successfully.
Let's show the drawing if we could. This is an illustration which we've had made. And if you could use that pointer and discuss with the ladies and gentlemen the bone marrow, how bone marrow works, the cells it produces, and I may have some follow-up questions.
Okay. So, the bone marrow, as the name implies, is tissue that is in the inner core of the bone. As I like to say, the bone is like a shell. You have the hard outer core that gives the bone its shape, and located in the center is the liquid part of the bone marrow. And interspersed between the liquid blood cells is a honeycomb of bone that where these blood cells grow and develop. And as you can see, the bone marrow produces red blood cells, several different types of white blood cells, and then these little things called platelets, as I previously described, are the little corks that keep the blood within the bloodstream. Now, basically, the blood cells are born, they kind of grow up and mature within the bone marrow, and then once they're mature, then they get kicked out of the bone marrow and they circulate around in the bloodstream from anywhere from a week to 3 months, depending on the particular blood cell.
Now, was the bone marrow specimen that was taken sent for examination under a microscope?
Yes.
And did you review the report?
Yes.
And did you actually review the pathology slides yourself?
Yes.
Is that something which you've been trained to do as an oncologist hematologist?
Yes.
And do you do that on a fairly routine basis?
Yes.
Pathology slides. And have you again recently examined the pathology slides of Mr. Harper?
Yes, I have.
All right, let's go first to page 935. And the bone marrow, the core biopsy was examined not only at Wellstar but at Emory as well.
That's true.
Is that fairly common to send a specimen for a second opinion like that?
It's something that we do on a routine basis and as needed.
And what were the findings on the pathology of the bone marrow specimen that was taken from Mr. Harper?
The predominant findings was that there was marked fibrosis or scarring within the bone marrow that produced an environment that was not healthy for blood cells to grow and develop.
Including white cells?
Including white cells.
Including platelets?
Yes, sir.
And what is the name for this condition where the bone marrow becomes fibrotic?
It's called myelofibrosis or fibrosis of the bone marrow.
Now, have you helped us in creating a photomicrograph of Mr. Harper's bone marrow and then found a sample photomicrograph at the same magnification of a healthy bone marrow?
Yes, I have.
Could we put those up, please, Catherine? Can you put them side by side? Or one on top of the other? Now, which one is which?
Okay. The bottom one is a healthy bone marrow. And what you're seeing here is that this is the a piece of bone that make up the bony honeycomb that I talked about earlier. And then these open spots is where fat used to be, but when they process the bone marrow, that fat gets washed out and you have open spaces. And that's normal. And then about 50 to 60% of the remaining picture here is the baby blood cells that are growing, developing, maturing prior to their release into the bloodstream.
I think the jury may have heard the term stem cells. I think we've all heard. What are stem cells?
Stem cells are the earliest form of blood cells. And in other words, to put it in terms that a jury may understand, is it would be like a newborn baby. So these blood cells all start out as stem cells, and then as they mature, they either grow up to be a red blood cell, a white blood cell, or a platelet, depending on how the growth and development is programmed within that particular stem cell.
This myelodysplasia or myelofibrosis, as Mr. Harper had, does that affect not only the number of cells, but the effectiveness or the ability to work of the cells?
Yes, it does.
And in what way?
Well, when you have myelofibrosis, this is Mr. Harper's bone marrow here, and you can see it's very different than the normal one. First of all, the most obvious thing is that all these holes are gone. And you see that the bone marrow is very pink versus kind of a purplish color here. And all that pink is all the fibrosis and scarring within the bone marrow that produces a very toxic environment for these stem cells to try to grow and mature. And because of that, these baby blood cells can't grow up to be healthy, infection-fighting white blood cells or platelets that are real sticky when they need to be, or they don't grow up to be good oxygen-carrying red blood cells. So with this kind of toxic bone marrow, not only is there not enough blood cells being produced, but the ones that are produced are defective.
The jury has heard some, I think, from a witness previously about leukemia. In your review of the pathology slide, did you have any opinions as to whether or not Mr. Harper was developing early leukemia?
Even though it was not stated in the pathology report, there was some evidence that he was developing acute leukemia.
And what is leukemia?
Leukemia is where the baby blood cells get stuck at a neonatal state and are unable to function at all.
Now go to page 5 and 6, please. Go to page 5 first. And is this your discharge summary?
Yes, it is.
And what was your diagnosis as a result of the pathology specimens and the other information that you gathered during this hospitalization?
So, I said he had pancytopenia related to possible myelofibrosis. Pancytopenia means the patient doesn't have enough red blood cells, white blood cells, or platelets. Then I mentioned he had a mitral valve replacement. I mentioned that he had a previous history of bleeding within the bowels from vascular abnormalities within the bowels, and then he had a history of cirrhosis.
Now, you got possible myelofibrosis. Did you have any doubt in your diagnosis?
I didn't have any doubt that he had a very sick bone marrow. I did have some doubt that it was myelofibrosis.
Did the Emory pathologist, the second opinion from Emory, did that subsequently confirm your opinion?
Not really. I mean, what it did say was that there was a lot of fibrosis within the bone marrow.
Do you, sitting here today, have any doubt that Mr. Harper was suffering from myelodysplastic syndrome?
No.
To a reasonable degree of medical certainty?
Yes.
Now, did you have a conversation with Mr. and Mrs. Harper? Did you discuss his condition? Go to page 6.
Yes, I did.
What is prognosis?
I listed it there as very poor, which I still agree with that opinion.
Now, doctor, do you have an opinion to a reasonable degree of medical certainty as to Mr. Harper's probable life expectancy given your diagnosis of myelodysplastic syndrome and myelofibrosis?
Yes.
And what is that?
6 months or less.
And what was eventually going to be the cause of Mr. Harper's demise, given the severity of his myelofibrosis or myelodysplasia?
It was either going to be that he was going to bleed to death because he wasn't making enough platelets, or that he was going to die of an infection because he didn't have white blood cells that could keep all the germs that we're always exposed to at bay.
The jury made a suggestion of 5 to 10 years life expectancy for this condition. Do you agree with that?
No, I don't.
Did you inform Mr. and Mrs. Harper of the gravity of the diagnosis?
Yes, I did.
Now, did you see Mr. Harper during his subsequent hospitalization on October 18, 2006?
I did not.
You had no role in his care and treatment during that hospitalization?
That is correct.
Is there, let me ask you this, is there or was there any treatment, given the fact that Mr. Harper had a number of conditions? He had peripheral vascular disease, chronic obstructive pulmonary disease, an artificial heart valve, Coumadin usage, and an internal defibrillator. Was Mr. Harper a candidate for some sort of surgical procedure like a bone marrow graft?
No, he was not.
Why?
Because, first of all, bone marrow transplants don't work very well in diseases where there's fibrosis of the bone marrow. Even though the chemotherapy that's given may be able to get rid of the unhealthy blood cells, it doesn't get rid of the fibrosis or the scarring or the unhealthy bone marrow environment, so that if any new blood cells are able to grow back, they're still subject to the toxic environment of the original bone marrow. Secondly, when we do a bone marrow transplant, we have to subject the patient to high doses of chemotherapy up front. And when we do that, we wipe out what few healthy blood cells he has, and that puts him at risk for the bleeding and for the infections that I've been talking about. So assuming that he made it through that, then when they do a bone marrow transplant, it can take months to years to find a bone marrow match. In addition, when the patient goes down to a bone marrow transplant center, they get huge doses of chemotherapy that would likely have killed Mr. Harper, given all his other medical problems.
Now, was Mr. Harper seen during the hospitalization of October 18th by some of your partners?
He was.
Turn to page 304, okay? Let's focus in on this. Is this a note by one of your partners on October 20th?
It is.
And what did he document?
He documented that the patient was not responsive. Looks like he was intubated on medications to keep his blood pressure up, and that his bone marrow disease is not treatable.
And did you concur with that at the time?
Yes.
Concur with that today?
Yes, I do.
Are you charging me to come here today?
Yes, I am.
What are you charging?
$500 an hour.
Have you ever been in a court of law like this before?
I have not.
During the 10 years that elapsed from the time of your diagnosis of Mr. Harper and today, has any attorney for the family ever tried to contact you and talk to you?
They have not.
Would you have talked to them?
Yes, I would have.
Would you have told them anything differently than what you told us today?
I would not have.
He's with you.